In this lecture, we're going to examine methods of logical reasoning by first examining different ways in which information is gathered in a very general sense, but then we'll work towards how information is gathered for the purposes of health research. And so when we talk about how new information is obtained in health science, there are 5 specific ways in which this is done. The first is referred to simply as tradition. The second is authority. Trial and error is our third. Logical reasoning, as I pointed to just a few seconds ago, that we'll discuss in this video, is the fourth one, and the fifth one is the scientific method. Now, in terms of the probability that the information gathered will be most valid, we see that the information progressively becomes, or the probability rather, that the information becomes more valid as we move progressively from relying on tradition to authority, trial and error, logical reasoning, and then finally the scientific method. Well, if we start with the first one here, tradition, tradition is a way of obtaining information by just simply accepting certain truths within a culture without necessarily challenging those accepted truths. And this is what we refer to as inherited knowledge that gets passed from generation to generation. And what we're really doing here with tradition is accepting precedent without question. And this is certainly the polar opposite of the scientific method. Now, the problem with relying on tradition to obtaining new information is that the traditions may not be necessarily valid, correct, or even if there is some truthfulness to those traditions, it may not be the most efficient way of performing certain types of health-related tasks. One such example, and this goes back many, many generations, is an assumption that the world is flat. Now, if we accept this in a traditional way of obtaining new information, we would not consider any possible alternatives to this notion that the world is flat. Moving up one level is authority, and obtaining new information via authority is based upon the information provider's experience, their success, and or their reputation. And so the obtaining information via authority, this is something that is often used in society today. And that's where we rely on the healthcare practitioner, we rely on the teacher, because we understand that those two professionals possess and a certain amount of training and education, in some cases more detailed and to a greater extent than others. And so the third level, or the third method of obtaining information, is what's called trial and error. And this is commonly used in what I call everyday life, where we don't have a systematic way of approaching certain types of new ways of doing things. The problem with trial and error is that it is time consuming. It's very often not reproducible, and there's no established plan. One example here is opening up a newly purchased computer. Very often, many people will not go through a systematic approach of reading a manual, but will just start pressing buttons until something works. That's an example of the trial and error method. Now, in health research, we rely on methods of what's called logical reasoning. And logical reasoning will take a more combined approach of using the researcher's personal experiences will use their methods of thought based upon their previously established knowledge, and step through a more systematic way of assembling and putting some sense to new information. Logical reasoning is a very systematic process that is governed by various established steps. And there are two general types of logical reasoning that takes place that we'll discuss. The first is called deductive reasoning, and the second that we'll address is inductive reasoning. So with deductive reasoning, we begin this process by accepting a general premise or a general assumption. Then we gather certain cues that are very general, and when we start with those general cues, we arrive at a very specific outcome. And there are usually three steps with deductive reasoning. The first starts with that general assumption based upon some sort of theory, and that forms what's called our major premise. And from our major premise, we then launch a minor premise off that initial foundation, where we then arrive at some conclusion. And so the concern here with deductive reasoning is that whatever conclusion we arrive at, that's going to be dependent upon the truth of the original premise. So we're going to conduct a research study here. And in this research study, we're going to make a major assumption. And the major assumption is that if people eat 3 fried eggs per day, that will reduce blood LDL levels. The LDL is what's called the low density lipoprotein, often referred to as bad cholesterol. The minor premise, based upon the major premise, is that high levels of LDL are related to cardiovascular disease, or actually it's considered to be a risk factor for developing cardiovascular disease. And we then come to the conclusion that because consuming 3 fried eggs per day will reduce blood LDL levels, and we're concerned with blood LDL levels because high levels of blood LDL is a risk factor for cardiovascular disease. Therefore, we connect the two and we say consuming 3 fried eggs per day, stepping over the LDL portion of this question and going right to the final outcome here of cardiovascular disease, that consuming 3 fried eggs per day will decrease the chance of developing cardiovascular disease. And so what deductive reasoning does is that it produces a testable hypothesis, which is one aspect of designing a research study. Now, if we rely only on deductive reasoning, that will inherently have limitations. And the limitation here is that our conclusion is based upon the truthfulness of the premises here, the major premise and the minor premise. And so we go back one step here, is the minor premise true? Is high levels of LDL, blood LDL, related to cardiovascular disease? And the answer to that question is yes. So the minor premise is true. However, is the major premise true? Does consuming 3 fried eggs per day reduce bad cholesterol? And the answer to that is no. The major premise is actually wrong here. But because the major premise is wrong and we're deducing from this assumption to our conclusion is not going to be truthful. So, but if we rely on deductive reasoning, we have to make sure that those premises are truthful. Now, the opposite of deductive reasoning is inductive reasoning. And when I say the opposite, is we're generating new information by going in the opposite direction. And that opposite direction means that we make generalizations, we arrive at conclusions as we did on slide 21, but we base those generalizations on specific observations. Recall on slide 21 with deductive reasoning, we relied on the assumptions that were not necessarily observed, but just assumptions of those two premises, the major premise and the minor premise. And so with inductive reasoning, we actually make an observation, a very specific observation first. And from that one very specific observation, we arrive at a generalization. So it's essentially the reversal in the direction of deductive reasoning. So an example here is performing meditation exercise. After knee replacement surgery, was observed, specifically observed. This is not a theory. This was observed in a patient. It enhanced their functional ability after the surgery. And so what we're doing here is we've made a very specific observation in one patient. Because of this specific observation, we might conclude that all patients after experiencing a knee replacement surgery should perform meditation exercise because it was observed in this one patient. So we start with a very specific observation, and that specific observation leads to a general conclusion for everybody experiencing a knee replacement surgery. Now, the inherent limitation with inductive reasoning, if we just rely on inductive reasoning, is the representation of the single patient in that one observation for the general population of people receiving knee replacement surgery. And that one patient may not be representative of all individuals that have knee replacement surgery. And as a result, all patients may not benefit in the same way from meditation exercise as that one patient if we rely solely on inductive reasoning to obtain this information. And so this is going to end this video, but what this will do here is set up the next video where we're going to combine deductive and inductive reasoning in generating a viable research approach.